Good afternoon. I will be sharing, my name is Dr. Jeffrey Carter. I'm from the Ministry of Health in Singapore. I'm a senior consultant in a public health group. And I would like to share with you about how we have controlled or how we are controlling COVID-19 in Singapore. And the information I give you is correct as at the end of September 2020. So as of 27 September 2020, Singapore has experienced more than 57,000 cases. And most of these cases have been discharged. As at 27 September, we have only had 31 cases in the hospital, no case in the ICU, and 275 cases in the community isolation facility. And we have had only 27 deaths. So we only hospitalized the more severe cases, and other cases are isolated in a community facility. We have three separate sources of infection: imported cases, cases in the community, and cases in our foreign worker dormitories or migrant worker dormitories. Now, first of all, for imported cases, all our imported cases are tested during their quarantine, and hence they are detected before they are released from quarantine. And this has helped to prevent any spread from imported cases. The cases in the community has remained low throughout September, and we have only an average of 2 cases a day in the month of September. For the foreign worker dormitories, this formed most of our cases. There was aggressive testing of all foreign workers in the dormitories, and this was completed since the 7th of August. But we continue to test them, and I will elaborate on this later. Our mortality rate is very low. We have only 27 deaths, and this is a ratio of then about 1 death for every 2,000 cases. Now, there are a few reasons for this. The first reason is that more than 95% of cases have occurred among the migrant workers. The migrant workers are younger, and as we all know, younger cases experience mostly mild disease. And the second reason is that we have been relatively successful in protecting our elderly population, including those living in aged and nursing homes. A third reason is that we have very aggressive testing. We test many asymptomatic cases, asymptomatic populations, and have detected many asymptomatic cases, and hence the denominator is reflects also a large number of asymptomatic cases. Now, this is our epidemic curve. What we are trying to show is that the 3 different sources of infection are presented in different colors. But what you can see is mostly all red, and that this shows that more than 95% or nearly all our cases are from the dormitory residents, especially in recent months. We did impose a lockdown, a community restriction period between April 7 and 1st of June. But it was mainly to try to control the number of cases in the community. So this is looking at the epidemic curve separately for the imported cases, the community cases, and the dormitory residents. As you can see, before the 7th of April, a number of imported cases were detected only after they were released from quarantine. And we learned from this experience, and hence, after that, all cases, all travelers who entered Singapore are tested before they are released from quarantine, and we have no further cases of imported cases who were released after quarantine. For the community cases, the lockdown from 7 April to 1st June have been relatively successful in controlling the spread in the community. And as you can see, since August, the number of cases in the community is very, very low. For the dormitory residents, the lockdown doesn't really apply to them. You know, there was aggressive containment, testing and containment efforts in the dormitory, among the dormitory workers. And this has now also been successful, and has the numbers in the, among the dormitory residents has come down. And as you can see from the epidemic curve, in the month of August and September, there were also very few cases of migrant workers in the dormitory. So our strategies to manage COVID-19 can be summarized along three areas, and I will elaborate on all these three areas. The first is talking about how we minimize importation of cases. The second is talking about how we detect cases early and contain them. And thirdly, I would like to elaborate about our preventive measures in the community, as well as control in our aged and nursing homes. First, minimizing importation of cases. As Singapore gradually reopened our borders, we take a risk-managed approach to calibrate our border controls based on our risk assessment of the importation from various countries. So we update ourselves with the available information on and make a risk assessment on the risk of having imported cases from different countries. So there is a travel now allowed for essential business and official travel to selected countries on bilateral arrangements, what we call reciprocal green lane. We have a special arrangement in Malaysia for essential business and work purposes. We call it periodic commuting arrangement. And we have our own people, our students who need to go overseas because distance learning is not an option. So we have allowed them to travel to countries such as Australia and the United Kingdom. And for Singapore, we are gradually opening up to allow travel to and from low-risk countries. So we have allowed travel from to and from Brunei and New Zealand. And we just announced that from October the 8th, we are also going to allow travel from and to and from Australia and Vietnam. Australia excluding the state of Victoria. So depending on the different arrangement, the type of precautions employed will be a bit different. So for example, for the unilateral opening, travelers who enter Singapore, they will be given a PCR test on arrival. Then they need to isolate themselves until the test results are available. And if the test is negative, they can proceed and travel within Singapore without any further quarantine or restrictions. Because in the community, they will just follow whatever safe management measures as the rest of the Singaporeans. For normal entry and our returning residents, what is done to them, it depends on where they come from. So if they come from countries with our assessed risk, where we assess the risk is very low, they can stay at home and be quarantined in their own homes for just 7 days and be tested before the 7 days. Whereas for other countries where we assess the risk to be higher, they need to be quarantined for 14 days, and the quarantine usually is in a quarantine facility, and usually this is the hotel. And again, they will be tested before the end of the quarantine period. Any cases, of course, that are detected, whether they have symptoms or not, they will be isolated in the hospital or in the community facility. Next, I would like to elaborate about early detection. For Singapore, we are testing very aggressively. We do a lot of tests. In the month of September, we are doing an average of more than 20,000 tests every day. For example, we test persons with respiratory symptoms. We will test all cases with pneumonia. We test all cases with any acute respiratory infection, no matter how mild the symptom is. Even if you have just a little sore throat, if you present yourself to a clinic, you will be tested as long as you're above 12 years of age. And I'm happy to share that in the month of September, we have tested more than 42,000 cases with acute respiratory infection and have only found 3 positive cases. So there's a ratio of about 1 case for every 14,000 cases of acute respiratory infection tested. Now we also do regular testing of selected high-risk groups. So we have voluntary testing of persons who have regular interaction with the public, for example, cleaners, security, food delivery personnel. And in the month of September, more than 10,000 of these persons have been tested, and no cases of COVID have been found. Most of our cases have occurred among the migrant workers in the dormitories and those working in certain industries such as construction and the marine industry. So for these workers, they are rostered for regular testing. They are tested every 2 weeks. So the idea is that because many of the cases are asymptomatic, and some of these asymptomatic cases can be infectious, so we want to be able to detect them as early as possible. So they are all tested every 2 weeks. Of course, in batches, not all at one go. So to organize all this testing, we have set up regional screening centers all across Singapore, and in about 2/3 to 3/4 of our primary care clinics, testing is also available. Now I'd like to talk about containment. All our cases are contained all our cases are isolated, whether in hospital, if you have more severe symptoms, or you are at higher risk of developing severe disease, such as you are an elderly person, for example. Otherwise, you will be isolated in a community care facility. We do not allow anybody to be isolated in their own home. We do contact tracing for every case, and all contacts are quarantined under the law. They are quarantined not in their own homes. They are quarantined in quarantine facilities. Again, we use a lot of hotels, and they are tested at the start and at the end of the quarantine period. We have been using technology to support contact tracing. So for example, using Bluetooth technology, persons can download a phone app called Trace Together, and this facilitates the detection of persons who have been in close contact with each other over a certain time period. We have recently also rolled out Trace Together tokens for those who have difficulty or unwilling to use their handphones for this Trace Together technology. Every case of infection that is detected, epidemiological investigations are done to try to trace how they could have got the infection, where the source of infection comes from. Going on to preventive measures in the community, under the law, it's mandatory to wear masks whenever you go out of your own home. And there's places of work, schools, and restaurants, and many places, it is compulsory to space persons out for at least 1 meter. We call this safe distancing. And in places of work, schools, places of worship, eating places, and so forth, it's mandatory for them to comply with safe management measures. such as making sure that people are staying apart for at least 1 meter and that people are wearing masks. So even in the workplace, you have to wear a mask. For work, the default is still work from home, but we have started allowing employers to bring some of the employees back to the workplace, but there are certain guidelines to follow, such as not more than a certain percentage of workers can be in the office at any one time. We continue to enforce restrictions on the number of people allowed in places. For example, in eating places, restaurants, we can only allow a maximum of 5 persons on each table. In places of religious worship, or wedding ceremonies, in cinemas and so forth, we can allow up to 100 persons, but they need to be segregated in zones of 50, and within each zone of 50, there is also safe distancing and wearing of masks that is compulsory. For some time, we have restricted the organization of community activities for our senior citizens, and only recently some of these have been allowed. Recognizing that persons who live in aged and nursing homes are a especially vulnerable group, there are various protective measures in place, such as there's continuous surveillance for acute respiratory infection and fever among the staff and the residents. And at the first sign of any such respiratory infection or fever, the staff or resident is isolated and tested for COVID. There are strong infection control measures by the staff is continuously emphasized, and these have been successful in preventing the spread of infection. We also zone the staff and residents in the nursing homes or aged homes, for example, by floor, and there's no mixing of staff or residents between the zones. So in this case, this strategy helps to prevent the spread throughout the nursing home, and it's limited to the particular zone. There are visitor controls. For example, each resident can only have 1 visitor at a time, and a maximum number of visitors per week, and each visitation is for a limited time, such as only for half an hour. Whenever a single case is detected, there is aggressive testing of the zone, and necessary quarantine and isolation is applied as we detect cases. So moving forward, because COVID will be with us for some time, we will continue to make sure that our measures are sustainable, is that the measures are evidence-based, and whenever there's new evidence or new information, we will examine the current measures and adapt the measures accordingly. We continue to make sure that the healthcare capacity is sufficient to manage any future waves of infection, and most of the healthcare facilities have now returned to their usual business as usual, and their usual activities, but if there are future waves of infection, the necessary healthcare capacity to manage COVID cases is in place. We also continue to ensure that healthcare workers are well supported and protected, and I'm glad to share that we have, throughout up to now, we have had less than 5 healthcare workers who have been infected in the course of their duty, and more healthcare workers are infected in the community and not from work. We also recognize that it is not just the government that is responsible. We need to involve the whole of society, and because all of us are in this COVID pandemic together, and we must continue to strengthen trust with our people. through open and timely communication. So we have regular press briefings, and we share information through all the platforms, whether it's the regular platform, print media, or social media. So we continue to provide regular updates to our people. So thank you very much for listening. This is our summary of how Singapore has been tackling COVID. I wish you a good day. Thank you.